I'm talking to diet therapist Mandy Carlin today. Hi, Mandy. How are you?
I'm good, thanks. And you, Joanne?
I'm very well, thank you. Mandy, today we're talking about the body mass index, or BMI. What is the BMI?
Joanne, the BMI is basically a mathematical formula whereby the individual's weight is divided by his or her height squared, and it's frequently used to assess how much an individual's body weight departs from what is normal or desirable for a person of his or her height. It does not, however, take into account body fat, or if a person's got big muscles or other health problems. It's just really a statistic to compare individuals to the norm. In other words, really a guideline.
Why is it important for us to be aware of our BMI? And do you think it's more important to be aware of your BMI than what the number on the scale says?
I think it's more important for a clinician to know your BMI than for you to know it. I think your weight going down on the scale is more important for you. Also, if your weight goes down, your BMI will naturally go down.
What are the different classifications of the body mass index?
The ranges for the normal weight classifications are 18.5 to 24.9. To be considered overweight based on the BMI, you must be over 25, between 25 and 29, and to be classified as obese, it's anything over 30 or 3 stone overweight. Having a BMI less than 18.5 is considered underweight, and although there are some exceptions, a low BMI usually means that you have a very low level of body fat. And in women, this excessively low level of body fat can cause their periods to stop, with resulting infertility.
Can the BMI predict my ideal weight?
It cannot predict your ideal weight, but it will give you an estimate of the weight range in which you should be in. But the distribution of weight is important.
Tell me about the distribution of weight and what the dangers are of having extra weight.
Many people come in many different shapes and sizes. You've heard of the pear shape and the apple shape. But basically, too much fat, especially around your middle section, puts extra strain on all your organs and can lead to heart problems, diabetes, cancer, and obviously obesity.
What alternatives would there be to the body mass index?
There's the waist circumference measurement, which can give an indication of the amount of abdominal fat a person has. Women with a waist circumference of 35 inches and men with a waist circumference of 40 inches are at risk. The waist to hip ratio measurements and body fat measurements can also indicate patients at risk of obesity and disease. If you carry fat in your midsection, you're more at risk of a heart attack, and other diseases increase significantly despite your BMI.
Do you think that one of the most important things that we need to consider when trying to lose weight is cutting out fat in our diets?
Joanne, I wouldn't say all fat. There are good fats and bad fats, and fat actually is an essential food group that one has to have, but that's the polyunsaturated fats. The saturated fats, which are in processed foods, it's melted fat, it's butter, it's lard, those are the bad fats to cut out, but the good fats that you find in nuts and seeds and olive oil and avocado should be consumed, but in limited quantities as they are fattening.
Thank you, Mandy. Thank you so much for talking to me today.
Great. Thank you for giving me the opportunity.